Good morning. I'm Dr. Tim Stewart with Gulf Coast Equine Hospital. And what we're doing this morning is the first video in a series of bandaging techniques for horses that our clients have asked us to make. And we're going to post these on our website so you can access them anytime you like. The first video is basically on the components of a bandage and why we bandage. So let's just go right through it really quickly. We're going to assume that you've already cleaned the wound and we're going to bandage it. And the components of a bandage start with what we're going to put right on the wound. And we're going to either put a non-sterile gauze that, like this, that will adhere to a wound, and I'll tell you why later, or we're going to use a non-stick cover over the wound that will not stick to the wound. And these could be non-sterile or they could be sterile components of the bandage. Now the reason we would use a bandage, a gauze like this that would stick to the wound is because sometimes when we remove our bandage, we want the bandage to actually debride tissue that needs to come out of a wound. So we will advise to use a non-stick in those situations. When we get a wound cleaned up and we just want the wound dressed and we want a non-stick bandage, we'll use a Telfa-like bandage. And there again, depending on where the wound is, it might be a non-sterile or it might be a sterile type bandage. The next thing is going to be what we put on there. Here are just a couple of examples of a povidone iodine type dressing and a silver sulfadiazide type bandage, type ointment that we use quite frequently. And then we will hold these gauze in place either with a roll gauze, sterile or non-sterile. And then over that, we will use an absorbent dressing. Here in the hospital, we usually use combine roll, non-sterile or sterile, depending on the type of wound that we are dressing. At home, we may recommend that you use a quilted leg wrap and a standing wrap. There again in the hospital, we'll almost always use the self-adhering vet wrap type product. And then we'll use Elasticon to make sure our bandage stays in place. And this is a very important component of many of our wraps. Now those are the basics. And so we'll get on to doing, today we'll go ahead and do a video on hock wraps because we've got a patient in that needs a hock done. And thank you very much for your time.